Okay, now we're going to move on to the eyes and the ears. Eyes are midline upon the face. They're symmetrical in size and positioning on the face. Eyebrows are once again symmetrical on the face. Good coloration of the brows, even hair distribution, brown in coloration. I'm going to palpate the orbital areas around John's eyes. Bones are intact, no traumas apparent, no lesions noted. Bones were in correct placement, no crepitus noted. Was it tender, John? No tenderness noted. Bilateral eyelids open and close fluidly. There's no ptosis noted. Eyelashes are evenly distributed across the eyes. Normal coloration of those as well. Lacrimal glands. The puncta are present, upper and lower. They appear normal in color, pink, open and patent, not reddened or swollen. Palpating the lacrimal gland itself, bilaterally, not swollen. Was that tender, John? No tenderness noted, no redness noted. Conjunctiva and sclera are pink and white in coloration. No concerns at this time, no discharge noted, no foreign bodies present. Once again, returning to the eyelids, there was no tremors noted at either. The external eye, looking at the pupils bilaterally. Pupils are equal, round, reactive to light, approximately size 4 in size. Irises are hazel, bilaterally in color. No nystagmus noted. Okay, John, I'm going to have you look at my finger and I'm going to move it in towards your face. Keep looking at it. Pupils accommodate in size. They move together symmetrically. They do respond to light. Corneal clarity had no arcus. The grade was 0 in the whiteness. Sensitivity for the corneal at this time, cornea, I would touch John in the cornea and all four segments of the cornea and make sure that he could feel that. Okay, John, can you open your eyes real wide for me? Can you feel that?
Yes.
Can you feel that?
Yes.
Feel that? Feel that?
Yes.
Okay, Jenny, to the other side. Feel that?
Yes.
That?
Yes.
That?
Yes.
That. Okay. John has good corneal sensitivity. Doing the Snellen eye chart. My Snellen eye chart is from 6 feet away. Moving back. John, what's the lowest line you can read?
LTFPH.
Okay. John has normal 20/20 vision at this time. John, I'm going to have you cover your one eye. What number am I holding up?
1.
What number?
2.
What number?
3.
Number?
4.
Okay. Now cover your other eye.
1, 2, 4, 5.
Okay. Attach the visual fields at confrontation test. Okay, John, can you cover your one eye? Follow my finger. Perfect. Now cover the other eye. Perfect. Now both eyes open. Follow them. Eyes move fluidly throughout. No signs of tremors or issues with the movements. Very fluid. Eyes move together. No nystagmus noted. Looking at the corneal light reflex. Both present in midline, symmetrical position. Okay, I'm going to have you cover your one eye. I want you to look in the distance about 10 feet away. Do you see me moving?
Yes.
Do you see me moving?
Yes.
See it?
Yes.
See it?
Yes.
Okay, do the same thing with the other eye. See it moving?
Yes.
Moving?
Yes.
Moving?
Yes.
Moving?
Yes.
Okay. Okay, John, I'm going to turn the lights off and we're going to do the ophthalmoscope for the portion of this exam. Okay. Looking at the lens of the eye is clear, is easy to see. Red reflex was present. Present in the other eye as well. Looking past, looking at the optic disc. Optic disc is present, orange in coloration. No lesions were noted. Retinal vessels were present. Veins were bigger in size than the arteries. The physiological cup appeared 1 to 3 in size. There was no edema noted. Foveal was present with a light reflection, and the Virtuous lens was approximately 10 to 12 millimeters, and anterior chamber appeared to be 3 to 4 millimeters. Findings were found bilaterally. Moving on to the ears, so I'm going to turn the light back on, Joe. Size is symmetrical on both sides of the head, normal for an adult male. Shape is also normal for an adult male. They are symmetrical in position on the head. Coloration is normal for an adult Caucasian male. No lesions are noted to either sides. No swelling noted either. I'm going to do some hearing tests with you, John. First thing I'm going to do is the Weber test. Where do you hear it? One side or the other, or midline? Perfect. Now I'm going to do the rhyme test. What I'm going to do is I'm going to do the same thing, but I'm going to place it behind your ear. You tell me when you stop hearing it, and I'm going to bring it forward. You tell me if you still hear it, okay?
I don't hear.
Do you hear it now?
Yes.
Okay. Doing the same thing to the other side.
I don't hear.
You still hear it?
Yes.
Now I'm going to do the whisper test. I'm going to step behind you, John. And I'm going to say 2 words. You're going to tell me what they are. 100.
100 cats.
Okay. Doing it to the other ear. Orange apples.
Orange apples.
Okay. Hearing appears normal for an adult male. No concerns for hearing at this time. Now using my otoscope, I'm going to look into your ears, John. Looking into the external canal, some small cerumen is noted, yellow, soft in appearance and color. No lesions, no foreign bodies noted. Looking past into the tympanic membrane. Tympanic membrane is a gray pearly white in coloration. Handle of malleus, light reflex, pars tensa, and pars flaccida were all present. No concerns, no redness or edema at this time. Doing the same thing on this side. Bilateral findings are found on left and right side. No concerns regarding his ears currently. Okay, moving on, we're going to go into the chest and lungs. Respiratory rate is even, easy, non-labored. Patient is in a relaxed position, no tripoding noted. Chest movement is symmetrical bilaterally. No use of accessory muscles is noted. Can you spin around for me, John? So I have your back's to me. Thank you. I'm actually gonna have you turn the other way so that they can see the camera. I'm sorry. Thank you. Okay. Take some deep breaths for me. Lungs are clear, posteriorly, listening laterally. Can you lift up his arm? Thank you. And do the same thing on the other side. Lungs remaining clear on the sides. Before I listen to the front, I'm going to do the examination on the back. Looking for thoracic expansion, I'm going to place my hands on either side. Okay, John, take a nice deep breath in for me. Let it go. Okay. My thumbs move symmetrically apart and back together. Chest is moving symmetrically. Good thoracic expansion is noted. Approximately 3 centimeters was bridged upon a deep inhalation. Next, I'm going to do diaphragmatic extrusion. Okay, John, I'm going to percuss your back, and I want you to take a nice deep breath in and hold it, okay? Ready? Okay, that is where our diaphragm is located. Now, I'll have you take a deep breath in and exhale and hold it. Okay, and that is where our this is a normal finding of 3 centimeters. Now I'm going to do the tactile firmness to the back. Can you say 99 for me? Say it again. Say it again. 99. Again. 99. One more time. 99. Perfect. Now I'm going to do the sides. Can you lift up your arms? Again. 99. Again. 99. Perfect. No crepitus or pulsations or vibrations noted during that exam. It was negative. Feeling the back as he's breathing and the musculature, I'm not palpating any crepitus. No crepitus noted. There was no crackles, wheezes, rails, bronchi, or friction rubs noted or stridor upon listening to the back and the sides of the lungs. Okay, John, I'm going to have you flip forward so that your front is facing the camera now. I'm going to auscultate the front of the lungs. Deep breath in and out. Again. Okay. Okay. One more time. Okay. Once again, finding was the same as the back and the sides. No concerns at this time. One last thing we're going to do is vocal resonance. Can you say cat for me?
Cat.
Again.
Cat.
Voice is nice and clear and resounding. Vocal resonance is fine. Okay, now we're going to inspect the heart. Normal sternal borders are felt. Apex is felt. Sternum is present in the midline and accounted for. I'm going to look from the side here, see if I see any pulsations or heaves or lifts. I'm currently not seeing anything. Sir, I'm going to have you lie back on your back on the couch, please. Once again, looking from the side, seeing if I see any pulsations, heaves, or lifts. Once again, that is negative. I'm going to palpate in the various positions to see if I feel anything, which I do not. No pulsations, heaves, or lifts. I'm going to listen in the various points, apical, second intercostal space, right sternal border, pulmonic, Erb's point, tricuspid, apex. Doing the same thing with my bell. Normal S1 and S2 sounds were noted, and no signs of murmurs in the supine position at this time. No signs of S3 or S4 sounds or splitting. Okay, sir, I'm going to have you lay on your left lateral side. Thank you. And I'm going to palpate once again for the apex. No pulsations, lifts, or heaves noted. Going to listen once again. Findings were the same as supine, nothing changed. Sir, can you sit up for me? Similar finding using the bell. No adventitious sounds, and once again leaning forward, sir. And then using the diaphragm. Sorry. No murmurs were found in any of those positions. Sounds remained the same, normal S1 and S2, no splitting, no sounds. Okay, so now we're going to move on to the abdomen. Before I go ahead and have you lay back, what I'm going to do is I'm going to do your kidneys. Can you turn around and face the camera so they can see your back? Thank you. Okay, palpating. Any pain or tenderness?
No.
Any pain or tenderness?
No.
That was checking the kidneys for post-vertebral pain. That was negative. Okay, sir, I'm going to have you lay back on your belly. Or, excuse me, on your back. I'm sorry. Do you mind pulling your shirt up just about your diaphragm? Perfect. Skin is normal coloration of a Caucasian male. No lesions noted. Abdomen appears soft. It is warm to touch throughout all quadrants. Skin is well hydrated and maintained. Auscultation. Abdomen is active in all four quadrants. Normal sounds noted. Listening for bruise in the arteries. Aortic. Renal. Iliac. And femoral. No concerns for bruits noted. +3 flow in all arteries noted. Abdominal muscles upon inspection are well aligned. Sir, can you lift your chin up to your chest, please? Abdomen, it comes together nicely. Muscles are well formed. You can relax, sir. No hernias, no bulging noted. Now doing percussion. Tympani noted throughout. No concerns, negative. And now I'm going to start feeling for various light palpation throughout the abdomen. Any pain, John? Abdomen is soft. No signs of distension. No masses. No hernias noted around the umbilical area. Now I'm going to deep palpate. Any pain, John? Okay. Upon deep palpation, no pain noted. Now palpating for the kidneys, I'm going to place one hand underneath the back and deep palpate. Any pain, John? I'm going to do the same thing on the other side. Any pain, John? None of kidneys were felt, which is a normal finding on an adult male with no health history. The right kidney may be felt sometimes, but not in this circumstance. Now I'm going to assess for the liver. I'm going to lift up here, take a nice deep breath in and out. Liver was not palpated at this time. Normal, no hepatomegaly thought at this time. I'm going to do the same thing on this side. Deep breath in and out. No contact in, my hand did not come in contact with any organ. Spleen is not noted. Did you have any pain on that, John? No splenomegaly noted at this time. Gastric air bubble is present and accounted for as is normal in an adult male. And dullness is noted to the right upper quadrant in juncture with a normal male liver border, and it is present. It's about 5 to 6 centimeters in length. No aortic pulsations are noted. I'm going to stand at the peak and look this way as well. No aortic pulsations are noted, which is normal in an adult male. No masses were found. Okay, sir, you can put on your shirt now if you would like. I'm going to palpate your arteries and the radials. Symmetrical and beat, +2 bilaterally, regular in rhythm and rate. Going to assess the carotids. And the other side. Same rhythm and rate, +2 noted. Going to palpate the pedal pulses. Can you uncross your legs? Thank you. +2 bilateral noted. Posterior tibial. +2 bilaterally noted. Good rhythm and rate, equal in all 4 extremities. I could also palpate for popliteal and brachial arteries if I choose, but I did distal, so the other ones are present as well. I already did the arteries for bruits in the abdomen. The only ones I missed were the carotids, so I'm going to listen for bruits in the carotids real quick. Negative on the right. and then negative on the left as well using my bell of my diaphragm or my stethoscope. It is +3 and flow. No concerns at this time. I'm going to have you take this pillow out for 1 second, John, and then I'll give it back. I'm going to be looking for jugular venous distension. Right now, the patient has normal jugular vein distension. No concerns at this time. I'm going to put 2 pillows underneath you, John. Can you sit up just for a second? Okay, now go ahead and lean back. Jugular venous distension is now gone. Let me look at my measuring tape here. And it is about 5 centimeters, which is a normal finding for an adult male. I would do bilateral. I would do the left side as well. No pulse rates noted. Looking at the peripheral veins and arteries, patient has no varicose veins. Skin coloration of the bilateral lower legs is consistent with the rest of the body. No swelling or edema noted. Legs are warm to touch. Skin texture is the same as the rest of the body, smooth and well hydrated. No concerns for insufficiency. There's good hair distribution across the legs. Musculature of the legs is normal for an adult active male. Did you have any tenderness during that exam at all, John? Me touching your lower legs? No tenderness noted to the lower legs upon palpation. Bilateral arms are the same as well. No swelling noted. Coloration is the same as the legs. Good hair distribution, normal coloration, no varicose veins or any sort of abnormalities there as well. Okay, John, you can sit up. Now we're going to be moving into the final 2 portions of the exam, the cranial neurological assessment and then the musculoskeletal assessment. Okay. I'm going to have you close your eyes, John. I have this to use for cranial nerve number 1. John, what am I holding in front of you? Can you smell it?
Coffee.
Perfect. Thank you, John. Now looking at the optic nerve and the nerves. If you cover your one eye, John, do you see everything on my face?
Yes.
Can you cover your other eye? See everything?
Yes.
Okay, perfect. Okay, cover your one eye again. How many fingers am I holding up?
2.
How many?
4.
How many?
5.
How many?
1.
Do the other eye. Thank you.
1, 2, 1, 4.
Okay, perfect. I did the pupil exam earlier in the assessment. Pupil exam was normal. Pupils were equal, reactive, 4 in size. Close your eyes, John. Unable to open bilateral lids, which is normal for this exam. Okay, John, follow my finger. Cover your one eye. Do the same thing with the other eye. No nystagmus noted, negative for double vision. Pupils are equal, round, and reactive. Okay, John, now I'm going to prick your face with some things. Can you close your eyes for me? Can you feel that?
Yes.
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 That?
Yes.
Okay. Now I'm going to do the same thing. You tell me when you're being touched.
Yeah.
Touch?
Yes. 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 Yes.
Okay. I could also check for a corneal reflex as well at this stage, but I'm not going to do that. Okay, John, can you make a frown for me? Can you smile? Can you lift up your eyes? Okay. Open your mouth real wide. Stick your tongue out. Move it side to side. Beautiful. Okay, now I want you to open your mouth real wide. Stick out your tongue and say ah.
Ah.
I can also check for a gag at this point. Okay, now I'm going to have you push up against my hands. Now I want you to turn your head into my hand. Push, push. Okay, good. Do the same thing on this side. Push, push. And now push down into my hand. Okay, trapezius and sternocleidomastoid muscles are 505 for strength. Now I'm going to do, we did the Renee and Weber's test earlier in this exam for the hearing. Both were, he passed both of those. Weber's was midline, and he did say he continued to hear the sound past the mastoid process. So, we'll also do the Romberg. Can you stand up for me, John? Okay, can you walk this way? Perfect. Okay, I'm gonna have you stand, put your feet together. Perfect. Okay, now close your eyes. Okay, perfect. Patient passed the Romberg exam. Balances normal, no issues noted. Oh, you're standing, John. I'm gonna have you walk. Can you walk towards that wall and back? Normal gait and stride. Patient is swinging his arms bilaterally in a normal walking fashion. Now, John, I want you to walk on your tiptoes. Can you walk on your heels? Patient has normal gait and coordination to do both of those as well. Okay, John, you can sit back down. Okay, I want you to do this with your hands. Okay, now I want you to touch my finger and then touch your nose. Touch your finger, and touch your nose. Patient has good coordination with rapid movements. Accuracy is noted. Now I want you to do this with your legs. I want you to take your heel, run it down your shin to your toes. Do the same thing with the opposite foot. Normal length to the upper arms and extremities as well. Now I'm going to have you close your eyes for me. Lift that body part that I'm touching. Okay. Again. 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 Okay. Normal sensation is noted with the vibration. Now I'm going to do the same thing. You lift it once I touch it. Perfect. Okay. Now, John, I want you to lie back on the couch, please. Okay, close your eyes. Which way is your toe going?
Toward me.
Which way is it going now?
Away from me.
Which way now?
Away from me.
Which way now?
Toward me.
Okay, perfect. Patient has good sensation in knowing which way the body part is going. Okay, keep your eyes closed, John. I'm going to give you this and you're going to tell me what it is.
Pen.
Perfect. Thank you, John. Okay, now I'm going to do 2-point discrimination. You're going to tell me if I'm poking you with 1 or 2, okay?
1. 1. 2. 2. 1. 1. 1.
Okay. I'm going to touch something. You're going to tell me what I'm touching.
Calf. Calf. arm, leg, arm,
Okay. Can you hold your palm out? Okay, I'm going to write a number. You're going to tell me what number it is.
9,
Perfect. While I have you laying back, I'm going to test for the plantar reflex. Extension of the toe is noted. That is normal finding in an adult male for plantar reflex. I'm going to do the abdominal reflex. The abdominal muscles contract towards the umbilicus as I stroke the abdomen, which is normal for this exam. I'm going to test for ankle clonus. Negative for clonus, it is a +2 finding, which is normal in the adult male. Next, I'm going to do the reflexes. John, can you sit up for me? Thank you. Okay, I'm going to do brachial, radial, same thing on this side. Okay, all +2, which are normal, and now I'm going to do your legs. Once again, all +2, which are normal. Last but not least, we're going to do the musculoskeletal. Having looked at John throughout this exam, skeleton is in normal shape and appearance. No trauma noted to any of the extremities. Extremities are in normal working order as shown by this exam. No apparent masses or lesions noted to the skeleton at this time. No deformities. Arms appear symmetrical in length. I will check for legs here shortly. Skin and subcutaneous tissues over the muscles and the joints are pink, warm. No swelling noted. Tell me if you're having any pain, John, with any of this palpation. I'll do the rest of the back when he stands up. Any pain, John? Joints feel normal for the adult male. No swelling, no warmth or tenderness noted upon palpation. Coloration is pink. Skin folds are normal distribution throughout. No masses. Muscles are consistent with an active adult male. Symmetrical bilaterally. No spasms or tics noted throughout. No crepitus was noted upon palpation either. Now we will do the strength and range of motion. Okay, John, I'll have you go like this, fingers in and out, and then roll your wrists. Perfect. Now I'll have you squeeze my hands. Perfect. 5 on 5 strength for that. Push against my hands. Pull towards you. Perfect. And now with your elbows, I want you to go in and out. Go across your body. Do the same thing with the other arm. Go behind you as far as you can. Perfect. Now go up towards the ceiling, to the floor. And now I want you to take your shoulder and I want you to reach behind you. Give yourself a pat on the back. Do the same thing, but I want you to reach under and back. Do the same thing with the other arm, up and over. Do the same thing, round and back. Perfect. Okay. Okay, now we're gonna do the head and neck one more time. Up towards the ceiling, to the chest. Give it a big, nice round circle. Okay, now I want you to stand up. Okay, now I want you to bend back. Bend forward, touch your toes. Perfect. Now go side to side. Okay. Normal S curve noted of the spine. Vertebrae are in normal alignment. No steps noted. Discs appear stacked on top of each other symmetrically. Can you lean forward and touch your toes one more time, John? Scapula are flat across the back. No, no bumps noted. No masses noted. Back is nice and soft. Okay, now I'm going to palpate hips. Hips are bilateral in height. Limb length of legs appears symmetrical bilaterally. Stand up again, John. Gluteal folds are symmetrical in height. Once again, normal finding. Okay, John, I want you to stick your one leg out, stick it back behind you. Okay, do the same thing with the other leg. Go out to the sides, and then cross it in front of you. Okay, do the same thing with the other leg. Okay, perfect. And then I want you to bring your knee up. Do the same thing with the other knee. Perfect. Okay, now we're going to do your hips. Can you lay back on the couch, please? Yeah. Okay, now I want you to bring your knee up, and then I want you to rotate your hip out. Perfect. Now do the same thing with the other leg. Okay. And then I want you to bring your knee up and kind of like this, kind of an upward. Yep. Now do the same thing with the other leg. Perfect. Okay. Last, we're going to do the ankles. I just want you to flex your feet to the floor, flex them up to your face, flex them out. Kind of do like a circle with them. Okay. Wiggle your toes. And then any pain on any of that movement throughout all the range of motion. No crepitus was noted to any of the range of motion. Patient has normal range of motion for an active adult male. No concerns were noted at this time for any of that. If something was a concern, I would go into deeper evaluation of that specific joint and doing specific tests for each joint. Otherwise, upon looking at the patient's feet and ankles, the patient has normal curvature of an arch of the foot. Upon standing and walking while the patient was doing a neurological exam, feet shape and size did not change while walking. Number of toes is consistent, 5 on each foot, 10 total. Alignment of all the long bones is straight with the joints. No concerns at this time for displacement or deformities like talked about earlier. All the muscle strengths were noted to be 5 of 5. Can you push down towards me? Pull up towards me. Push my hands down into the couch. Push up to the ceiling. Perfect. 5 of 5 noted for that as well. John, do you have any questions about any of this examination that we just did?
No.
Thank you for participating. I appreciate you.